When can I use my contacts after eyelid surgery? When can I start putting my contacts in again after upper and lower eyelid blepharoplasty surgery?
Thank you for your question. You submitted a question without a photo, but you're asking when can you wear your contact lenses after cosmetic upper and lower eyelid surgery? Well, I can certainly assist you with this question. This is a question that comes up pretty much every day in our practice. A little bit of background, I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan, Long Island for over 20 years, and cosmetic eyelid surgery is something we do in our practice every day. And this issue with or question about contact lens wear comes up very frequently. So the way I first answer this question is by understanding a little bit about the person's eye health and the dependency on contact lenses. For example, if someone has a very severe nearsightedness or myopia or has a condition like keratoconus, they're very dependent on their contact lenses to function. So I try to figure out how to facilitate that process so that they can wear their contact lenses sooner rather than later. As a general rule, I look at the patient in terms of also their state of comfort with wearing contact lenses. Now, it's almost a given that someone who can tolerate contact lenses has adequate tear production to be able to lubricate those lenses. Now, there are exceptions. Sometimes you actually manage dry eye with contact lenses, but that's a therapeutic issue. But in terms of eyelid surgery, I explain the following. Anytime you operate in the area around the eyes, there is going to be some degree of temporary dryness. So, as far as wearing contact lenses, I tell my patients that you can pretty much wear your contact lenses after about a week. The reason why I use the 1 week time frame is that one, antibiotic ointment has to be applied if you're having upper eyelid surgery to the stitches in the upper eyelid. If you're having lower eyelid surgery, and typically we do these procedures from a transconjunctival approach, you're putting ointment on the inside of the eyelid. Now that means that invariably some of that ointment gets mixed in with your tears. And getting an ointment on contact lenses can get messy and difficult to clean those lenses. In addition, I also advise patients to understand that when you have surgery around the eyes, that your eyes can be slightly drier than they are baseline. It's just a normal part of the swelling-induced diminishing of lacrimal function, of the function of the tear glands that are embedded in the conjunctiva, that are part, that produce the tears that give you your baseline tear film. What I tell people is that carry around some contact lens solution. So for a couple of weeks after they're done with their surgery, they use these contact lens re-wetting drops, specifically re-wetting solution, to allow lubrication in case the eyes feel a little bit dry. On average, pretty much at 1 week, I'm comfortable with people wearing their contact lenses, and we've never had any significant issues with that. I always, having an eye surgery background, ophthalmology background, I get into the details of what their vision status is as well as their ocular health status, so I can give them guidance on how the eyelid surgery can actually affect their contact lens wear. There are also times when we actually do a procedure like a lateral tarsal strip or something to help support the lower eyelid in a way that actually improves tear function and tear distribution. And I always tell them that there actually will be potentially a benefit to the eyelid surgery in terms of helping contact lens wear. A lot of times people develop ptosis, they develop laxity, and sometimes contact lens wear can have some role, directly or indirectly. Directly in, let's say, from wearing of hard or soft contact lenses, the upper eyelid kind of rubs against the lens and causes some thinning of the tissue. maybe resulting in ptosis. And with lower eyelids, I feel like people pull their eyelids sometimes aggressively to put contact lenses in, and that can kind of put the lower eyelid on stretch. And as well as other ocular factors can affect the impact of contact lens wear on eyelid surgery, and then of course we have to figure out how to adjust the eyelid surgery to optimize the ability to wear contact lenses. So I hope that was helpful. I wish you the best of luck. Thank you for your question.